Outside a hospital in Guayaquil, Ecuador, a family seals the coffin of their father with plastic wrap.
Aquí tienes que comprarte todos estos equipos para entrar allá.
¿Con qué resultado? ¿COVID positivo o no?
Insuficiencia pulmonar. A todo el mundo le ponen lo mismo.
Le ponen insuficiencia.
¿Sabe para qué? Para que digan que hay pocos muertos de COVID.
Many people in Guayaquil blame the government for failing to slow the spread of coronavirus and to deal with the thousands of bodies that have piled up in the aftermath. Guayaquil has suffered arguably the worst COVID death toll in Latin America. The thing is, Ecuador had acted earlier than its neighbors to close borders and order strict quarantine. So what went wrong?
Que el Ecuador se infectó cuando vino la primera contagiada.
Tenemos más de 3 días llamando a esa verga.
From the start, the 1-2 punch of rapid contagion and the ensuing death toll caught local and national officials off guard.
Tenemos el primer caso confirmado de coronavirus en el Ecuador.
On February 27th, doctors in Guayaquil diagnosed the country's first COVID-19 patient, Bella Lamia, a 71-year-old retired teacher, otherwise known as Patient Zero.
She was living in Spain. She came through the Guayaquil airport and she drove through her hometown.
Dr. Esteban Ortiz Prado is a medical investigator helping to advise the government on the pandemic.
And in her hometown, she visited all of her relatives. She went back to Guayaquil and found medical services in Guayaquil in a private service clinic. She got really bad. She got in the ICU unit. 5 days later, she got the diagnosis. So 2 doctors from that first clinic got also positive because nobody knew about it.
It took 13 days to diagnose Lamia with coronavirus, and in that time, she infected many other people, including much of her family, pictured here in 2019. In all, 3 family members died, including Bella herself.
She totally infected 17 people confirmed, but we know that the culture in Ecuador, before getting the diagnosis, could spread the virus more. We lost track right there.
After she arrived in Ecuador, Lamia stayed in the home of her niece, Cassandra, in the town of Babahoyo.
Ella nunca supo qué enfermedad tenía. Y hasta ahora muchas redes sociales nos apuntan como si mi tía fue la culpable de que el virus se propagara acá en el Ecuador.
Bella Lamia was certainly not the only case. There were at least 6 other flights from Madrid to Guayaquil between the time she arrived and when she was diagnosed. Other travelers later tested positive for COVID-19.
Ella nos contaba que en el avión ella le había dado fiebre y que mucha gente venía tosiendo en el avión. Una vez de que ella ya llega al aeropuerto, no existieron por ningún lado los protocolos.
And that was the first problem. We didn't track very well the entrance of people from the airport. So in the first 2 weeks, most of the patients came from the airport.
Those lost weeks led to an out-of-control epidemic. 2.5 weeks after Bella Lamia's diagnosis, the country was on lockdown. 2 weeks after that, Guayaquil was in the throes of the most aggressive outbreak in Latin America.
It is true that at the very beginning it was a disaster. We're learning by mistake, by errors that we made.
This is Dr. Juan Carlos Ceballos. He was installed as Ecuador's health minister in late March, after the former minister resigned. He admits the government should have tested and tracked patients, but he also blames residents for not following stay-at-home orders after Bella's diagnosis.
Ecuador, as I said, was prepared. Did all the measures in place and very early. Unfortunately, the people didn't hear us and they did not obey those restrictions.
Like a lot of cities in Latin America, a large segment of Guayaquil's population lives day to day working informal jobs. So to stay home means not eating. It was a perfect storm of factors that left Guayaquil's hospitals and morgues overwhelmed. Now the government of Ecuador has another dilemma: just how to bury the thousands of bodies that have piled up in the weeks after Lamia's death. Ecuador's official COVID death toll is several hundred, but forensic police have been working around the clock to collect and account for thousands more dead. And construction is now underway for various large burial sites around the city. Container trucks like this one transport corpses to one new site on the outskirts of Guayaquil, in the neighborhood of Pascuales. Local residents, fearful of contamination, are outraged.
No quieren que los demás países, que las demás personas, que las otras ciudades se enteren lo que está pasando en realidad aquí en Guayaquil, aquí en Pascuales.
Officials in charge of handling the dead have promised that each body will have a separate resting place. We attempted to film drone footage of the new burial site, but Ecuadorian soldiers ordered our team to bring the drone down and temporarily confiscated our footage. A human rights worker documented the incident.
Vecinos han denunciado el ingreso de tráiler al menos 3 veces al día con containers llenos de cadáveres supuestamente a este cementerio donde habría una fosa común.
Since the first coronavirus diagnosis, distrust of the government's handling of this crisis appears to have spread as fast as the contagion itself.